I said, my name is Guy Rocourt. I am I'm co-founder and chief product officer at a company called Papa and Barkley. Papa and Barkley is a California-based wellness company. We do topicals, tinctures, pain relief patches. We also do live solventless concentrates. We do have a national CBD line, but to me, CBD is just part of a larger cannabis movement. I've been a cannabis advocate and cultivator for the last 20 years. I started right when Proposition 215 landed in California. I started cultivating, started dispensaries, and have just been in the game. I was blessed to come to Colorado in 2011 and start my first compliant business outside of the traditional market. And you guys know we don't say black market, we only say traditional market, right? Because people have been providing safe access for decades, and CBD is the leading edge of the cannabis movement. But this panel is really about hemp. And when we talk about hemp, that does not mean CBD to me. CBD is a cannabis cannabinoid. It's trapped in the trichome. That needs to be the right cultivar. And while the feds have told us that cultivar needs to be less than 0.3% THC, it is still a cannabis cultivar with trichomes that hold those cannabinoids. And yes, we can breed those cannabinoids down to less than 0.3%. That's the cultivar we should be getting for CBD, just so that everybody's clear. I think there's a little misinformation about that. But for this panel, since we are talking about hemp, one of my first questions to the panelists is, besides CBD, what are some of the other great things that the Farm Bill is going to allow the hemp plant to do for us? Why don't we start with Heidi?
Sure. Well, because I have the litigation perspective, one of the big things that I've been dealing with that has changed massively in the last 8 months is transportation. There was a lot of arrests. There was a lot of actually capturing the product. And even though we were able to oftentimes get it back, now you've got some hemp that's been sitting on a floor in some government facility for 2 years. So it's really not valuable to you anymore. So one of the cool things that's come out on the litigation side for me from the 2018 bill that applies to all of hemp is crossing state lines and being able to transport this stuff on a national scale. And I'm from the Midwest. Trucking is big business. And actually, there was just some regulations released 2 days ago, or proposed regulations of kind of best practices with respect to transporting hemp. And so for me, that's one of the biggest advancements that we've been able to see is the, really the access and being able to go over state lines. And for the states that don't have their own pilot programs or, industrial research programs, now you can source that stuff from elsewhere and you can have a meaningful company in your home state. So that's been a big thing for me is that litigation has just completely fallen off the map. And, there is a little bit of confusion over this. So if anyone is confused on this, you are able to transport hemp over state lines. And if anyone's telling you that you can't, or if anyone has arrested you, please feel free to reach out to me.
Do you guys know how incredible hemp is? Besides CBD, which is by itself totally incredible, hemp is a plant that can provide us with high-quality food-grade fats and proteins, all plant-based, obviously. It provides us with raw materials for paper, building materials in the form of hempcrete, hemp-based plastics, which are all potentially sustainable building materials that can help us get off of petroleum. It is a phytoremediator. It can grow in contaminated soil and pull out heavy metals. And it's got all these other applications for like animal bedding and building materials and plastics and stuff like that. So separate from CBD, the fact that the United States is finally getting on board with hemp, which many other countries have been doing the whole time, it's opening up the potential for a whole new economy-changing sectors all over the place, separate from CBD.
So when I think about, just to piggyback off my esteemed colleague here, one of the greatest things to happen to any market in terms of legalization, but especially with hemp, is the ability to have insurance. Yeah. And it's not just the crop insurance, which is what you all hear about most, but it's the ability to have product liability insurance for insurers to feel more comfortable in the marketplace, so that if you do get sued over a business dispute, you have the ability for someone else to pick up your legal costs and guide you through the litigation. That's huge. And similarly, the normalization through the 2018 Farm Bill, and really it began in 2014 through the appropriations and forward, is the comfort level of tertiary industries to step into this marketplace. One of the largest problems you have is manufacturing equipment that can turn hemp into viable non-CBD related products. When you're talking using the whole plant and turning it into fiber, well, the companies that have that technology are now starting to step into the field. The traditional farm equipment companies, the traditional processing companies are now bringing their products to bear on hemp, and I think that's wonderful.
Mm-hmm.
I would have to say, Snake covered the main topics, but on the home front, hemp has revitalized farming. Like, I personally have seen people who have been in a wheat, corn, soy rotation 4 generations, and it's nothing that, they don't bat an eye at it. Now they're farming hemp, and there's just this revitalization of farming techniques. People are relearning things, and it's cool to them. Like, they're excited to get the hemp into rotation. And it's bringing these communities together in rural areas where it's bringing them together in a different way, because there were farmers who kind of forgot their roots, so to say, after the first prohibition. There's a lot of 70-year-old plus farmers in Minnesota now who absolutely love the fact that they can go outside in the morning and they have what was once called the devil's lettuce to them, and it's growing in their backyard. Like, the communities that are coming together now, farmers before, in agriculture, they didn't necessarily have a plant that was medicinal on their land. Now they have a medicinal plant. And the joy of being able to go outside and just pick this resinous flower, you just have to see it for yourself. It's a real rewarding experience, I would say.
Yeah, so I understand a lot of folks might be new to the industry. So if you guys don't know who Jack Herrera is, I definitely suggest you look him up and get his book called The Emperor Wears No Clothes. He laid it out for us. I guess it would have been in the early 70s. Hemp, I think the motto is hemp to save the world, food, clothes, medicine. When we have the Farm Bill, what it allows us to do is start to roll back some of the big mistakes we've made in our country. Right now, if you were to start a t-shirt company and you were to go out and say, I want to make them hemp-based, you would have a sourcing issue. That's ridiculous. We produce way too much cotton, and its carbon footprint is way too large. So just growing hemp for that would be great. We could get into hempcrete. We could get into hemp seed oil. If you guys haven't seen hemp seed oil turn into biodiesel, it's amazing. And when you start to run those numbers versus the corn ethanol subsidies, you start to realize, oh wait, there's some political forces at play here, and we start to experience the truth and say, what is the reality of the best practices for our land, for our country? Hemp starts to play a big factor. We're not going to do a deep dive into why hemp was prohibited or why cannabis was prohibited, but now that it's only looking forward, it is about time. And now that we have this Farm Bill, we can start to roll back the carbon footprint of some intensive plastic is another big one. Bioplastics from hemp are amazing. BMW is already using hemp fiber as opposed to carbon fiber. So using these natural fibers as opposed to fibers that come from petroleum, that's a huge political button. We are so dependent on petroleum products, but we need to start to roll plant-based products in as replacements. That's really what the Farm Bill says. That being said, my next question for our panelists is, how do we continue the legal fight? So for instance, I'll start it off with, we still have people getting arrested. We still have misinformation about whether or not we can transport it. And I know for my company, when we extract the oil and we need to go from the farm with an extracted oil to the manufacturer, that product is technically hot. We wrap it up in the COA of the Farm Bill, or the COA of the actual flower, but in processed products, more legislation around that. So why don't we start with Justin around how do we continue this legal fight?
Oh my gosh. That's a loaded question with loaded product, right? If you're not testing your oil pre-transport, there's a large chance that you're going to get hit with hot product. And there's really no reason why you shouldn't be able to, but the Farm Bill has a definition, and that definition is 0.3% by weight, period. And you'll hear conflicting things through the grapevine about whether or not you can ship hot product. The answer is no. and the DEA is the DEA. Law enforcement is law enforcement. And they're not going to take the more lenient view, period. I have never known a cop that would just be like, you're above that. Just no, you're okay. No, that's not. Automatons are going to be automatons, and that's what they do. One of the hard things that has come out since the Farm Bill is this Idaho case. That shipment that got seized in Idaho. There was actually federal litigation involving this, and they said, look, there's no FDA regulation right now, which means that nothing you're doing is legal until you have that. We have some guidelines and some guidance. We have some, United States Postal Service guidance as to what you can and can't ship. But the states that are anti-hemp, Idaho, South Dakota, they're going to continue to have this stance until they're told otherwise by the FDA. And so you really have to plan your logistics routes to avoid getting into that. We talk about litigation and getting into litigation. Avoid litigation.
Yes.
Whether you're right or not, you're going to pay for having to prove you're right. And even then, the chances depend on which judge you draw out of a hat. and that's a big gamble. There's certain counties, certain places where what kind of judge you're going to get. But if you get popped in a jurisdiction that has, horrible conservative judges, you're going to get a horrible conservative result, and you're not going to get your hemp back. It's going to sit on the warehouse floor.
Yeah.
And Heidi,
And-
before you
yeah.
you jump in, because I want to just put a little nuance on it for the crowd. What's super important about this in process is right now outside we have what I call a race to the bottom with distillate products and isolate products. That's not whole plant medicine. I can tell you as a 20-year advocate, that's not why I got into the game. So when we do a basic extraction or a solventless extraction, a clean extraction, and we have this hot intermediate, that's why it's so important to understand how we further the legal fight so that a better product can come to market. Most of the CBD companies out on the floor now are using a distillate product, so yeah, it's refined, and the in-process product before it goes to the manufacturer is 99.9 CBD, and they have nothing to worry about. But how do we get a real full-spectrum plant medicine if our in-process product is concentrated and has slightly elevated levels of THC, even though it's going to be diluted down in product? So, Heidi, your thoughts?
Yeah, no, I totally agree. And to piggyback off both of you, Justin's absolutely right. I mean, right now, and you're right, and this game should not be a race to the bottom. The way that we can move this forward legally in a responsible way is to hold ourselves to the higher standard and to put in best practices for your business that exceed the bare minimum standards that exist right now. And one of the biggest things that Justin was talking about, and I can't say this enough, is test, test, test. If you are cutting corners on your testing and not getting it done, or skipping a certain batch or something like that, that is a huge problem, not only for your business, but also for the industry as a whole. Because now we're going to end up with reactive legislation, like you're seeing with the vape situation, that's not benefiting the entire industry, and it's not benefiting your business if you have to destroy that batch or ruin your reputation or get into litigation, because you will be paying for that even if you are right. So I think the biggest thing that we can do right now is to be integrous about our businesses, hold each other to the higher standard, and to not pass around advice like I've even heard, in different conferences where it's like, oh, in my state, even if you are over a certain amount, they're not going to come and get you. Don't say that kind of stuff. Like, that's not the world that we should be living in. Hold your business to the higher standard, hold your colleagues to the higher standard, and we'll get some responsible legislation in here. But if we're going to freak everybody out with this industry, particularly CBD, and we're going to be making medical claims, we're going to see FDA regulation that is not permissive and is not beneficial for the industry.
Yeah, and I'll say this, for anyone in the room, I talked about it during the What You Can and Can't Say panel. If you haven't read the Curaleaf warning letter,
Yes.
you should get on the FDA website
It's
and
short.
read that. It's
Yeah, read it.
It's incredible. I was amazed. In the Curaleaf case. We've been seeing all of these large national retailers come on board with CBD lately, and CVS CVS, which is the company that was selling Curaleaf, CVS is a highly regulated company. They sell pharmaceuticals. You know, they're used to that kind of stuff. And yet somehow this whole Curaleaf thing slipped through the fingers. And not only that, but I looked last week at another brand that they're selling at CVS, and they have claims all over their site.
Yeah, Rite Aid's
It's
doing it
amazing.
right now too.
Yeah.
It's absolutely
It's incredible.
unbelievable. Yeah.
Yeah, and it really comes down to whether you're thinking short-term profits or long-term profits.
Right.
I mean, if you're thinking short-term and really capitalizing on a movement and you're putting those claims out there, yeah, fine, but you won't have a long-term product. You're going to get the warning letter, you're going to get seized product, and you don't want to be that guy.
Yeah.
Although, to be the devil's advocate for a moment, does anybody know what the penalty is for getting a warning letter from the FDA? Anyone?
Opening
There's
the
no
letter.
penalty. The
Opening
letter, the letter is the
Paper cut.
penalty.
Yeah.
And if you do what they say and change the things that they say you have to change, there's no fine, there's no nothing. It's just a little embarrassing.
Yeah.
And so that's why people push the envelope. People push it and push and push it, and they get a letter like, oh, sorry.
But I will say this.
It's true.
Yeah.
If you get the warning letter, they're not just going to put in the one thing you did wrong. They're going to put in all things you've done wrong.
Yeah.
That's right.
So if you're using a CBD isolate and you draw a warning letter, there's really no way to correct that because your product is a CBD product. And so even if you correct the other things on the labeling, at the end of the day, the warning letter still says you're using CBD isolate. CBD is a drug per Epidiolex. And if you don't correct that, then you can get seized product, which is why you don't want to draw the warning letter in the first place, because you don't want them to come down on every other thing that you have wrong with the product.
So while I obviously agree with counsel in terms of understanding and upholding the law, I can tell you as a cannabis advocate, we have to advocate for truth. We need better plant-based medicine. Isolate is just not good enough, right? And so I'm happy to know that there is no penalty because I would take that over and over again. I'd risk way more than that. I can tell you to bring good, safe access to all folks, especially in my home state of California. But you know, maybe we can talk a little bit about, especially from the wellness perspective, why broader spectrum full plant medicine is better than isolate, and why we have to continue to demand that I don't really care if the FDA regulate. I'd rather regulations. Like, I embrace regulations, but let's have a thoughtful scientific conversation about real plant-based medicine and its efficacy and how I can provide that to customers. Any thoughts on that, Brian?
One thing I can say is bringing the right cultivars to the light is probably the first route to go. If you're using an industrial type, which you just kind of hijacked from Canada, and you expect to get CBD flowers off of it, you're in for a rude awakening. And there's a lot of people out here who will spend millions of dollars, $2 to $3 a seed, without having first even put in, just probe the market. It boggles my mind. Just if you wanted to just hire, a student at the university who's on in their summer, just do something to kind of lessen the effect of things that you're unaware of as you start this business. I can't lament enough how many farmers now are calling the university, and they kind of make it sound like it's our fault. It's weird. You guys didn't tell us these seeds were supposed to be grown like this, or you didn't tell us that we didn't. You guys purchased these seeds at $5 a seed and planted out 20 acres, and now you're mad at the university for not having an extension page on this. It boggles my mind. But I would just say, just move slower and have a clear concept about what you want in your end product, and be aware that hemp, there's multiple cultivars for different things. There's food, there's fiber, there's flour, and be aware of these things. And when you make your crosses and you're making germplasm, and another thing I'll say, stay away from this feminized seed thing. That's a good way to get yourself caught in these litigations that these guys are talking about. Yeah. You can go on.
Yeah, and the other thing I'd say is be active. In terms of any federal regulation, when we see draft regulations come out, there's the ability to comment on the regulations, to fill the gaps, to create new regulations to match the industry. Right now, I don't know if you've listened to any legislators talk about this, but they're only talking about, CBD. half of them probably think CBD means cannabinoid. And they're not talking about CBG, they're not talking about CBN, and there's a real gap, even in terms of what THCs you're talking about. The definition of THC is so broad, but it's not capturing, the other THCs that are out there. And so be active, be in an industry group, watch the regulations, comment on them, because if you're not making the rules, someone that doesn't have knowledge is going to be making the rules, and that's dangerous.
That's super
I
dangerous.
think that you guys, if you're investing in a company, partnering in a company, starting a company, I think what we're getting from the panel is the fight's not over. You need to have an advocacy component. You still need to have a voice so that you can have a better business. I am a little dismayed seeing a lot of great expert marketers, I don't want to take anything away from them, just using the API because it's kind of a fad with no advocacy, right? I personally get disturbed when I see THC free because I don't think you need to say that. There's a law, you can abide by it, but demonizing any other cannabinoid when there are folks still sitting in jail that have brought this movement here doesn't sit right with me. But another big misconception, we now see CBD or hemp oil in all kinds of consumer products, makeup and such. I wanted to hear from the panel, maybe starting with Brian, about the difference between hemp seed oil and cannabis oil or cannabinoid oil, because they are different, and I think the two get conflated. Lately, I've seen a lot of moisturizing products that say cannabis sativa oil. Well, okay, which oil is that? Would you like to tell the crowd the different oils?
Yeah. So basically one is food, the other one is medicine. It's as simple as that. You're going to use the pressed cold oils the same way that olive oil is used. But when you start speaking about the medicinal side, now you're talking about, as Guy says, full spectrum extracts. These are the ones that affect change in the body. Topicals, CBD topicals, I don't know. I'm not going to comment on that. Yeah, you guys know what I'm talking about.
So this question that you're asking about the difference between the hemp seed oil and the hemp oil that people are using as a code word for CBD, that's all just an indication of how badly we need regulation in this sector. Because the reason people are saying hemp oil instead of CBD is so they can get around rules like on Amazon. You can't sell CBD on Amazon, but you can sell hemp oil. But you can search for CBD on Amazon, and then all these hemp oil products come up, and they're the same as CBD products that you see off of Amazon. So it's a really confused marketplace. People are coming to this, looking for help with their suffering, and they're finding a marketplace where they can't even tell what they're buying. And there's unscrupulous operators out there who are putting hemp seed oil in and suggesting that it maybe is medicinal CBD oil. So it's bad. And this is why we need regulation, so it's clear what we can do and what we cannot do, and so that we can speak directly to the consumer and say, this is CBD oil. It's got 20 milligrams of CBD in it. That's what people want to see. It's full spectrum, whatever. And the other thing about the full spectrum isolate issue is sort of more broadly in this kind of environment where there's the only thing we know for sure is that the rules are going to be changing for a little while until they kind of settle down at some point in the future. So from the point of view of a brand, if you're in that environment and you need to get your products out into that environment without waiting for things to settle down, whenever they settle down, you need to make some decisions. And you also need to do it in a way that reduces your risk in this dynamic environment. And one of the things that is a risk, I think, that people aren't taking too seriously enough just yet is that it's possible when the FDA comes out with their rules, it's possible that the rules are not going to be very friendly to the kind of work that we're doing here, CBD as a supplement. One of the things that they could do is they could say, okay, isolate has to be pharmaceutical, and broad spectrum extracts up to a certain amount of CBD, those are okay for supplements. If that happens, we're going to have to reformulate.
Yeah.
We have to be ready for that.
That's a real risk, too. I mean, right now, trying to read the tea leaves with legislators saying that they need a pathway to CBD, that leans away from pharmaceutical. But at the end of the day, it's the FDA that's going to make the call. And they could say you're going to be treated just like Advil. And they could carve out a marketplace for pharmaceutical-grade CBD. In terms of hemp seed oil and hemp seed versus full spectrum, there is a very legal difference. The hemp seeds have been approved as generally recognized as safe. Full spectrum hemp extract has not. So, you know, every product you see here that is a food-based full spectrum product is technically non-compliant because it's not generally recognized as safe. It hasn't been approved as a new dietary ingredient. You know, those are the standards for adding it to food and the standards for adding it to a supplement. And so this is, again, where we have to be active with a voice to make sure that the products that we currently have out there are going to be available under the new regulatory schema.
Yeah, and just to piggyback off that, if you look at kind of the outcome from the FDA's hearings in May, that's kind of where it looks like it's going. I mean, if you made me guess, I mean, I would say that, yeah, I think you're going to see regulation that puts all of this out completely. I mean, the food is already, they're pretty express about that, but we're doing it anyway. I think you're going to see those regulations come out and be very unfriendly, especially to the food and drink industry. And one of the things that the FDA has said is that they're going to come out with some strong enforcement also. So I don't know what that will look like because right now we've got these kind of toothless letters at this point. So I do think that's the direction that we're going. And I think just to piggyback off what Justin said earlier too, if we're not speaking up at these hearings and telling them how devastating that would be for the industry and for patients and for just the general populace, they're going to go ahead and do that. And just the last thing I want to mention on that is, you know, hemp industries had a big case last May. Gosh, it's been a year and a half now. But when they went to go challenge the DEA making new rules, the Ninth Circuit couldn't do anything. And the reason is because not a single person commented on that issue. If it had been raised as a public issue, they could have reviewed it. But not a single person sent an email at midnight. Nobody sent a single comment in. So the Ninth Circuit couldn't do anything. So even if you don't have some sort of amazing, valuable input, at least say to your lawmakers or the FDA or go to these public hearings and just say, hey, I'm flagging this as an issue. I'm not sure why, but this one feels wrong. And if that's all you can contribute to this discussion, please do it. Because then it empowers our courts and it empowers us to go and raise these issues and brief them.
Yeah, it may seem, you know, kind of like you're throwing your voice into the wind,
Yeah.
but it's very real legally that
Yes.
if you don't use your voice, you lose your voice.
Yeah.
You lose the ability to challenge it based on that.
It's real sad. There's a lot of people who are making these laws who are still using the reefer madness science.
Yes.
You know, like when you're talking to these people, reefer madness is what's playing through their mind, and it's so bad. And it's you know, like you said, if you don't speak up, there's people out there who are still using reefer madness science to regulate these things, and
They will
they're
speak up.
and those ones will speak up exactly.
Yeah. And there's people out there, the pharmaceutical industry, who is the FDA's other constituency.
Yes.
And they have a very powerful voice at the FDA. And you think about it from the point of view of the pharmaceutical industry. If you're GW Pharmaceuticals or any other of the companies that have been working on CBD pharmaceuticals, they've been investing for a decade, tens of millions, hundreds of millions of dollars, on the assumption that when these products hit the marketplace, they were going to have a monopoly on CBD. And they don't. They're coming out into a marketplace where there's this big, unregulated, really dynamic CBD industry. And so it's really a battle at the FDA to determine how much of the CBD sector is going to be owned by pharmaceutical companies.
Yes, and that was one of the outcomes from the hearing too in May, was that they said that they really want to incentivize private companies to do this research. That's not good. You know, they really want to close off this market and empower GW Pharmaceuticals and these other major companies to really kind of take this away from us. And I think that would be absolutely devastating.
That's
Here's
one.
the good news, you guys. Obviously, advocacy is still a very big part of our movement. In Canada, CBD is regulated along with all other cannabinoids, which I think it should be. In California, where we've been leading the charge for quite some time, we are not allowed to use quote-unquote hemp-based CBD, but at my company, all our products are mixed ratio products. So I think the good news or the silver lining here is CBD is not an isolated. CBD and CBD industry is not out on a limb by itself. It's always been part of a larger, greener cannabis movement, and plant-based medicine is coming. It's coming to our nation. We need it. We see it happening in California. I hope that at the Sacramento level, we can start to grow better CBD cultivars and have those come into our system. I would love to see our nation regulate all cannabis as one product, including CBD and mixed ratios. The feds don't have a handle on that. Luckily, folks like GW, don't have a handle on that. On our scientific advisory board is Oren Davinsky, so he was the investigator for Epidiolex. I'm pretty familiar with that product, and even they have evidence that at 20 milligrams per kilo of CBD, even trace amounts of THC or in fact any other cannabinoid start to increase your uptake and therefore lower that percentage. Because 20 milligrams per kilo means somebody like me is taking 1,000 milligrams a day, and right now that's cost prohibitive, right? So advocacy is still a big thing. So as you go back out on the floor and you're talking to companies, investing companies, if they don't have an advocacy bent, if they're not using their voice, then they're probably just marketing and trying to get a quick buck. We should all be in this for the long term, because it could be taken away from us, but really, what's the right thing to do? For me, for the last 20 years, it's been about providing safe access of cannabis-based medicine. And I want to continue that fight, which includes CBD and a myriad of other cannabinoids that we have yet to really do research and identify. Moreover, I think plant-based medicine over the farmer model, the concept of wellness, these new things that are in the zeitgeist with other consumer products. I think about isolate, and I think about myself as a kid, only having white sugar and white refined flour. Now, I would never feed my kids that. You wouldn't. We go for raw sugar, we go for less refining, and yet, as we now are getting this first acceptance of plant-based medicine, the first thing we want to do is over-refine it. That doesn't make any sense. Why make that mistake? Well, with that, we have a few minutes. I would like to take some questions from the audience for the panel, so we'll start with this gentleman here.
A couple questions. Thinking we talk about pharmaceuticals. Really, over-the-counter drugs fit into this. Is that a whole other segment? Can you further push us down? And then what has to happen to get Ross for CBD?
Yeah. So over the counter, when you're talking products like Advil, that's where I'm talking. I don't think that the FDA is going to come down and say that it's only going to be a prescription-only drug. I think what they're going to say, if they say it this way, they're either going to say that CBD is a supplement. I think that full-spectrum hemp oil will definitely be seen as a supplement, but there's a chance that it could be put in the class of over-the-counter drugs. And if that's the case, you're still looking at pharma grade, meaning that you're going to be, you think it's heavily regulated now. When you're in that pharma grade industry, you are in a whole nother class. The cost has gone up significantly, and only big players are going to be able to front that cost. And I apologize, what was the second part of your question? Oh, grass. So you have to make an application. No one has made an application to say full spectrum hemp oil is generally recognized as safe or should be a new dietary ingredient. Those are the two classes. Someone should at this point at least do an application for NDI. It's an expensive process. Only a large company is going to be able to front that cost to get that through. But someone made the application for hemp seeds back in the day, and it's just the next step in the process to get that approved. I wouldn't recommend anyone do it right now because I think the FDA is going to come down and make a decision on that without the need to make an application, so I think it would be wasted money at this point.
Yeah.
Okay. She's got the mic right there.
Look, I'm new to this industry. I'm coming from chemicals and fine chemicals, but also food contact, some experience.
Cool.
I think maybe Eddie and Justin, I think you mentioned 2 points about approvals, isn't it? And maybe I'd like to hear your comments. If this, say, CBD, broad spectrum oil or CBD, can claim therapeutic effects, in other words, drug level activity, I think it would follow the strict FDA approvals with clinical studies. There is no other chemical that is approved on a broad spectrum composition. It's typically a single chemical that what drug companies make, following very rigorous to confirm that therapeutic effect. Now, if it's just an additive, nutraceutical, so that grass or safety, who cares what it does? You can claim it's not therapeutical, it's not drug. Safety of consuming is of utmost importance, and it's a different approval process, much more relaxed. Can you comment which way it may go? Because I think the hurdle of approving broad spectrum product as a drug, I think enormously high. I may be wrong.
Yeah, let me jump in first real quick. Yeah, so I totally appreciate the question, and we always talk about, how much whatever the LDI is, or like how much of this substance you can take, and do these studies need to be made? I just would make the argument or start the conversation with plant-based medicine is different than pharmaceutical medicine. I would put to you that we have spent the last 100 years going down to single source API, focusing on that API and what it does, making pharmaceutical products out of those single API, and yet we still have significant parts of the population that don't respond well when we have single source medicine. If aspirin comes from willow bark, there are people that have bad effects and side effects from aspirin. I think that as a concept, we should be looking at plant-based medicine holistically, and while it's more complicated because it's not a single source that can be studied, it's a variety that's constantly changing. I will take those side effects, because they're usually low tox, as opposed to trying to drill down to the single source API in the model that we've done before. But I'll let the legal team and the wellness team can.
Do you want to talk about red rice?
No, I don't actually. Gosh, I just wrote a blog on that a couple of weeks ago. You know, unfortunately, I think what we're seeing from the comments from the FDA is not what you're saying, and I think that's a terrible thing for the industry. Because if you actually look at the enumerated comments that the FDA had after the hearings, a lot of them were about what dosage is permissible, what is safe, what are drug interactions. If you look at the language of their conversation, they are going down a different path than a wellness perspective. They're going down a straight pharmaceutical perspective here. And I do think the lobbying is huge. And you know what's kind of funny about this whole thing to me is this time last year I was sitting here talking about how I was expecting to have a bunch of clients sued by Epidiolex, but they haven't had to because the FDA is doing their dirty work for them. So at this point, they're in bed together, and I think the language that you're seeing from the FDA is really suggesting that we're going down a straight pharmaceutical route. That's my perspective.
Yeah, and look, I would say, I think they're not mutually exclusive. Like, we should be, greater minds in ourselves should be getting single source APIs of CBD, CBG, THC, doing extensive clinical testing. That would be an open and honest conversation, allowing universities to do that kind of research. We need it. But on the other side, we now luckily have decades. This is the second, if not third, cannabis revolution. Since the 1960s, we've been using whole plant medicine with zero toxicity, right? So there's a lot of good body of evidence that we can make these products. So for instance, Oren Davinsky himself, when I sat with him and said, hey, I need to come out with some other products in the market. Do I really need to go through this formal 120-day, clinical process and spend that money? He was like, make good assumptions, make good, consistent formulations, and deploy products. Because that's what it comes down to with plant-based medicine. We do have this historical body of evidence. That's not to say that we shouldn't also allow doctors to do research on single source API to see what their actual effects in the body are, and then try to figure out how they work synergistically.
Yeah, and just the last comment I'll make on that, not to be a dream crusher or anything, is just, I do think, and I think you hinted at this earlier, I think the language that you're seeing from the FDA is that there might be some sort of compromise here where there will be a certain percentage that will be allowed and that will be regulated differently. That looks like it's going to be a very low percent, but to anyone who's thinking about pivoting and staying compliant, I think that's where your business is probably going to be going, is to a very low-level CBD until this process happens. And frankly, I do think we need more research, but I don't know that privatizing it through the pharmaceutical industry is the way to do it.
No doubt.
I don't think that's the way to do it, actually.
Yeah.
Oh, I was just going to tell you what my prediction is for how all this stuff moves forward.
Yeah.
My prediction is that there's going to be some rules. The FDA said they're going to come up with rules in the fall. I don't know if that's going to happen or not, but they're going to come up with some rules. They're not going to be satisfactory. It's going to go into the courts. It's going to also go into Congress. There's going to be, there is already, there's a lot of activity at the level of the federal government, the Congress and the Senate, working on different aspects of cannabis legalization or liberalization, whether it's the banking bills or the hemp being in the Farm Act last year. The Farm Bill was a part of this. And the outgoing FDA commissioner, Scott Gottlieb, last year, he said in his comments after he'd stepped down that he thinks the way forward is a legislative solution, that the FDA itself can't provide a solution that's going to satisfy all the different constituencies.
Awesome.
One thing I can say is that as an herbalist, I will say that it's been super rewarding being able to put this plant back in the apothecary. When it comes to full spectrum medicine, full spectrum plant medicine, the herbalists are at the top of the game. We understand full spectrum plants and how they interact with each other, and then furthermore how they interact within the body. And then furthermore, we factor in the ethnobotany of the person, so certain responses to certain plants can be lessened or intensified based on your genetics origin. With that being said, with the suite of cannabis products that have come out on the market now, I can see people going back to their old roots and looking for consultations with their local herbalists. And like I said, like Guy was saying, they are all coming into us apprehensive about the single molecule, just the isolate. They'll come in and say, I've tried CBD, and I know that this plant works for me because I used to use it way back when I was, younger. But now when I try these products, it's a weird thing. So I want, how can I use the whole plant safely and legally? So that's just another thing that's going on now, too.
So, folks, we're unfortunately out of time. The panelists and myself will be out here for questions if you guys have any follow-up questions. But as you go through the day, remember Jack, food, clothing, medicine. Hemp is far more than CBD. Cannabis is far more than CBD, and we still need to have a voice. We need to change. We are part of a greener revolution that can change the paradigm of how we approach healthcare, how we approach medicine. It does not need to be the way the FDA or the way pharma has always done it. I don't know that they've been successful. I mean, you guys see ads for pharma on TV. There's a huge percentage of failure known as side effects, right? There's a huge percentage of the population that is not affected. And so while plant-based medicine may have its inconsistencies and may need to be worked on, I would say that we need to have that voice. As Americans, as people of the world, we should have that option. Our country's way behind on cannabis-based medicine and hemp production for both reasons. So please take that away and enjoy the rest of the day.